everybody, good evening and welcome to this evening's thinking. I'm Liz, I'm an editor and partner at Tortoise, and it's nice to see you all. I think most of you will know the drill by now. The idea of the thinking is that we want to hear from you. We're kind of crowdsourcing, if you like, ideas, perspectives, points of view, and ideally story leads, new things that we can look at and investigate that we can bring to bear in tortoise journalism in the future. Today's exam question, if you like, was prompted originally by a number of different members who wrote in and said, I feel like there's something in this relationship between the rates of people who seem to be getting very poorly and dying from COVID-19 and them being overweight or obese in the clinical language. And I want to talk about the sort of framing of the political narrative, because Boris Johnson has made obesity a sort of political issue in terms of personal responsibility, because of course what COVID has helped us to really remember, or at least sort of has heightened our awareness of, that the responsibility we take for our own health is so much interrelated with everybody else's. And the obesity question has been sort of positioned in that same way. So today we're here to talk about food policy. We're here to talk about social health, I guess, as it relates to what we eat and the shapes of our bodies. I'm no doubt that we will also end up talking about mental health, probably poverty as well. So there's a very wide scope of things that we want to try and dig into this evening. My colleague Phoebe Davis is going to do her best. Hello, Phoebe, to marshal the chat. So if you have ideas, experiences, and as I say, perspectives on this, please don't hold back. This is a safe environment. You can say whatever it is that you feel is appropriate to bring to bear on the conversation. I'm going to kick off this evening with Mira Senthillingham, who is a global health journalist. You do work with lots and lots of media properties, notably CNN, and you're currently on maternity leave, Mira, but you've made time to join us this evening. So thank you very, very much for doing that. In general, and speaking as somebody who's spent some of my career working in what is lovingly called women's media, I sort of think that when it comes to healthcare in the media, a sort of good rule of thumb is proceed with caution. There's a lot of untruths, half-truths, mangled truths, questionable statistics. I think maybe let's get us started off on the right foot. The link between but really the worst COVID outcomes and obesity, I think, is clear and is proven. We saw some of that in the charts at the beginning. But if we take COVID out of the picture, I very much wish we could, but if we do, for this hypothetical question, even before the pandemic, is obesity in this country really on the rise? If I look at, I can see very conflicting reports, just a couple I dug up today. One says it's doubled in the last decade, and one says very gentle increase since the 90s. What is the truth about the scale of the problem, if you like?
I think with obesity, it's been an issue for such a long time now. So you saw a kind of really rapid trajectory in kind of from the 60s, 70s onwards. And it really did go up in adults, but a lot of countries, I think, including the UK, again, kind of numbers differ, expert opinions differ, but it seems that it has slowed down more recently. In some countries like the US, some experts say it's plateaued. I think in the UK, obesity perhaps has plateaued a little bit or slowed down, but overweight hasn't necessarily being overweight. So they're the two distinctions. And a lot of the stats and kind of health consequences you see relate to being both obese and overweight. So usually those kind of statistics are combined together. Okay. But it is very much still a problem just because of the percentage of people that are either overweight or obese. And most experts I've spoken to recently, like for the most recent article I've done on this, is that people are concerned about the rise in rates among children. So childhood obesity is the issue that's still rising exponentially. And so as a result of that, a lot of kind of priorities policy-wise are trying to target that. But it is very much a problem. It's not, I mean, just because it's not increasing as rapidly as it was, I think that's not always the point, because we've seen with COVID, the vast number of people living, like being obese or overweight, and then the conditions they then live with is the problem and what policy needs to address.
Mira, I wonder if you might just give us a bit of a sense. I think sometimes we in this country allow ourselves to fall into lazy stereotyping of our health. I'm going to say health rather than weight or body size relative to America, for example. And you talked just then about rates of growth. Is it the case that we can be comfortable overall as a national picture that it's not as bad here as it is in the States, a country that we lazily imagine to have very much worse eating habits than we do in this country?
I mean, we can't be and we shouldn't be comfortable with that ever. But I mean, the rates are higher in the US. They're higher in other parts of the world too. Say Mexico, I think the Middle East has high rates. The Pacific Islands have always had high rates. But the UK has always had the highest rates in Europe. And, you know, a lot of what we do compares to mainland Europe and our kind of cultural differences, dietary differences, and so on. And that's where we stand out, like, on the continent. And globally, we are still amongst the highest when it comes to the numbers. We're not, if you look at a map and you look at percentages, and the UK's always kind of stands out, and it's a darker colour when you look at the gradients and so on. So it is, we do have a high burden and we can't be comfortable.
Is Boris Johnson right to make this a political issue, a political priority?
I mean, yes, because that's what most people have wanted for a long time. I think they've always said to truly address the problem, you need to address it at the state level, give it a high priority. It needs a political commitment. Whether or not they do that correctly and address the right causes of it is another question, but it does need political commitment, definitely.
Okay, thanks ever so much, Mira, for getting us going. That's a nice, neat segue, almost as though I planned it, to speak to Dolly Tice, who is with us. You're studying, I know, for a doctorate at the moment at the epidemiology unit at Cambridge. You've done a lot of work in looking at the links between eating habits and deprivation and those sorts of things. And you've recently done a big piece of work that's looked at policy. And I guess the short question is, Mira's right to say, successive governments have tried, and if the data that Mira's talked about is right, failed to tackle this. What are they getting wrong in terms of food policy?
Where do I begin? So as an overview, this year, which is, it was totally unplanned with this piece of research, actually marked 30 years of government obesity policy in England. It was in 1991 that the UK government first formally recognised its role and sort of came out and said, we need to tackle this issue. And it was the year that it first set obesity reduction targets, which if you look back at now, what they were aiming for is sort of laughable in terms of where we are now. But this whole, I mean, listening to the kind of introduction and introductory chat is so fascinating, because I feel like I've moved so far away from thinking about this as an obesity issue and more just why is that? Obesity is one outcome of many different outcomes as a result of how hard it is to basically live a healthy life in our modern age. And health is a very, very different situation to when, for example, the NHS was founded. We were dealing with very different conditions, diseases, risk factors, that kind of stuff. And yet we still have a very similar idea of kind of where responsibility lies and how individuals should take responsibility of their own health, and still having to make the case that there might be a reason why we're having certain rates, because it's jolly hard to be healthy in the current food environment and culture that we live in, as well as the body image expectations and mental health issues and all the stuff that I'm sure we will talk about in this discussion. So I put that out there as I have a fundamental problem with the framing being so targeted and focused on the issue of obesity. I find it deeply stigmatizing, and it doesn't allow us unlock our imagination about the kind of policy ideas that need to occur to really make it easy for everyone to live a healthy life, regardless of our circumstance and background. But when it comes to government policy, we've had 30 years of government policy, as I said. In that time, we've had 14 major government strategies. 7 of them were sort of broad public health strategies, and 7 of them were focused specifically on, called sort of obesity strategies, and contained within them almost 700 government policies. And I analysed all of them to try and understand what policy ideas are being proposed over that time. And more importantly, because we also tend to focus on, is it the policy ideas that are wrong? It's not just the policy ideas that may be problematic or not quite concentrated on the right thing. It's also about, do they actually get implemented? You can have all the right ideas, but if nothing actually happens after a government proposes them, then we're not actually going to be tackling these kind of issues. So I looked at the policy types and the likeliness of the policies to be actually implemented, and I spent honestly the analysis with my jaw on the desk most of the time. The largest proportion of all almost 700 policies did not fulfill a single of the implementation criteria that would make them likely to be implemented. The largest proportion, compared to just 8% that had all 7 pieces of information that would be increase their chances of being implemented. So you would also see over those 30 years repeated policy ideas. And to give you an example of the most recent government strategy, so Boris Johnson published his obesity strategy last July, and within that was contained almost exactly the same policies that were proposed in the 3 strategies prior, and those were all published under a Conservative government. So you don't even need a change of government party in order to have more likely to have another strategy rather than implementing the policies already proposed. So there are lots of issues around not just the ideas, but also the way in which government conducts its business and carries out its own ideas.
So 2 follow-up questions to that, Dolly. One is, what are the barriers to policy implementation? And why would you bother just rehashing the same old stuff if nothing ever changes? And the second one, I don't know which is the right order to tackle these in, is what actually are the policy options that have been considered when it comes to a targeted sort of food strategy? What is available to you to play with?
So I'll start with the second question as a bit of a background. So there are lots of different policy tools that can be used, way beyond even the ones that have been proposed so far. But broadly, the government has tended, and probably unsurprisingly, the government has tended to focus on capacity building, which is essentially when it proposes a new body like Sport England to be set up, or the role of public health minister was one policy once upon a time, or monitoring policies such as having the National Child Measurement Programme that measures and weighs children in school. So sort of institutional capacity building policies, which is really sort of providing learning tools and the actual capacity for government to deliver policies. And then when it comes to policies that are actually focused on tackling the issue, it's been much more focused on information provision. And the kind of general assumption with an information-based policy is you just give people information and then they'll go away and they'll change their behavior and, your uncle, you've solved the problem, despite the evidence very much showing us that that's not the case. And very little of the policies proposed over the last 30 years have focused on shaping the environment to make it easier for people, wherever that is, whether that's proliferation of takeaways on high streets or the food in schools, healthcare services, whatever it is, it has not focused so much on helping make it easy for everyone. In terms of the barriers to implementation, again, where do I begin? I'm currently studying this in detail at the moment, so I'm sure I'll have lots more juicy insights to give you in a couple of months' time. But sort of anecdotally, based on the stuff that I've looked at so far, there are so many issues to implementation or barriers with regards to implementation. One very simple one is the kind of feedback loops within the political system. We reward good ideas, but who goes away and actually implements those is not so much rewarded. And in fact, I've come across quite a lot of evidence of negative feedback loops the moment government starts implementing things. So you actually are more likely to be criticised or have negative feedback loops when you start implementing something, because people will, become divisive and say it's not working, even though it's a long-term policy or whatever it is. So it's much easier and you get much more reward for just announcing another policy, which is precisely what we're likely to see much more of and have done over the past 30 years. And then on top of that, it's expensive to implement stuff because policies tend to cost money. And if they don't, and they're like the soft drinks industry levy, then you're looking at tax issues and you have to make all sorts of political arguments to justify it. And And implementation is difficult. Doing stuff is difficult. We know that down to our individual lives. The ideas are the easy bit. And I find it fascinating to try and understand what are the conditions that we could create in terms of government policy making to better facilitate implementation. And there are so many roles that we as individuals can play, which is recognizing when things are moving towards or moving in the right direction, knowing how to celebrate stuff moving in the right direction, but not saying that's job done. Understanding that solutions can also equal additional problems. So we have to see policy solutions as being interconnected and a kind of ever-evolving process, which may sound exhausting, but if we embrace that, we're more likely to move towards tackling these sorts of issues. And we have lots of successes in the past in terms of tackling public health issues that we can draw inspiration from, tobacco reduction being one of them. There was no one policy that helped reduce tobacco reduction. It was a number of policies over a number of years. And it was only when we started to move towards understanding how you could shape the culture. And we know now that among teenagers, the smoking rates are very, very low in terms of take up compared to previous generations. And it's sort of no longer cool. And that is the role that policy can have in terms of creating a culture that makes it easy and appealing and not stigmatizing is probably the dream situation we can be in when it comes to living a healthy life. And for that not to sound like we're all eating rabbit food and on exercise bikes for 9 hours a day, because I would not want to sign up for that.
No. Much less be able to do it. Thanks ever so much. Sorry, there's tons of stuff, and I can see some already really important and useful contributions in the chat, and I will come to Annie. I'd love to speak to Holly, Bex, Sean. There's lots of people that are weighing in. So while you sort of mentally prepare yourself, I'm going to come to Rose. Is a award-winning you're a columnist now, you're a journalist, you're a podcaster, Rose of all trades, and a good friend of Tortoise. We've touched on the framing that this government in particular, although they're not unique, have sort of posited this idea of personal responsibility. I don't think it takes a genius to realise that not all lifestyles are by choice. Okay, there are other factors that lead to it. I wonder if you might comment to begin with on the possible negative impact on people of feeling pressure to, in inverted commas, eat healthily.
Well, where do I start? So essentially, I think in terms of the pressure, like, I don't know anything that is less conducive to people being successful in terms of changing their healthy eating patterns than doing so under pressure. I think that the way that we talk about these things inherently puts obviously a lot of responsibility on obese people. The thing is that we do sort of tend to generalize in different groups. There are people that are obese for many different reasons. There's a massive genetic component to it. In my own experience as an obese person, I think a big problem is, as Dolly mentioned, the stigma and the shame. Like, I think when you I think the big thing that we haven't addressed so far in this conversation is how much of a component emotion is in terms of eating, and how much of a factor it is in terms of the way that we all eat. And to be honest, I think that it's a red herring for us all to just look at, obese people and think, oh, well, they're the problem. Actually, as a nation, as a world, we all have a problem with eating. People that are obese may be more visibly, piling on pounds, right? But people who are naturally thin, that eat lots and eat very unhealthy diets, aren't necessarily a picture of health internally. We have rising cases of all sorts of different lifestyle related diseases. I have always thought that putting weight on is actually a useful marker for someone, because I know plenty of people who don't put weight on and don't have any idea that they're unhealthy internally until later. I think it's a good way of But I think that singling obese people out and putting a pressure on them to change their lifestyle rather than looking at a holistic societal change that addresses how we all eat, because I think one of the things that is lacking from the government's policy is, so far as I can see, is there's a lack of compassion, right? I think blaming a certain segment of society and, you know, it existing in a fat body is pretty miserable, actually. Like in society, like you feel, you know, you get jokes made about you all the time, you get blamed for lots of things. Like existing in that category, when a lot of the behavior that we you know exhibit, the way that we eat, is encouraged by many factors, by advertising, by you know, government policy, by the way that the food industry is sort of created, and the way that, you know, the world and society teaches us about food. I think that it's not just a problem that needs to be lumped on the shoulders of obese people. I think we need to talk about nutrition as a whole. We need to talk about the way that, you know, private sector companies such as, you know, food, drink companies plus diet companies, the way that they are creating this society and this culture that that is setting people up to fail. Like I remember, you know, I've actually got experience of being obese, losing a lot of weight. Like most other people that lose a lot of weight, I put weight back on again. And, you know, the world is really set up for you to fail. And I think one of the most frustrating things for someone in my position, particularly someone that gained quite a bit of weight during the pandemic, like I did, was looking at how the government was on the one hand, you know, sort of saying, oh, you know, obesity, really awful, needs to be addressed. The other hand, encouraging everyone to eat out. Like at one point during last summer, McDonald's was 50% off. Like, you know, if we want to talk about food, we want to talk about, you know, getting people healthy, it has to be a really consistent and, you know, holistic approach that takes into account the fact that we have built a society that sets people up to fail. And I think that is much more important than, you know, saying to people, you know, take your dog out for a walk or whatever. I think we need to, you know, it really fundamentally is about education, because I don't think, and the ironic thing is that as an obese person, as a fat person, I think that fat people and obese people tend to be much better informed about nutrition than thinner people, because they have to be. Like, I don't know many people my size that haven't done every single diet like under the sun, because you know, like when you exist as a fat person, you are posited as a problem. That puts a lot of pressure on you. Obviously we can move into mental health problems, but you know, there's a massive problem with eating disorders, which are massively rising. I keep saying the word massive, which but just to highlight, when I was listening to the sort of lead into this, I heard the word problem, you know, mentioned maybe over 10 times, right, in relation to obesity. As an obese person, all I'm hearing is you're a problem, actually. And the thing is that, like, most people that are bigger than, you know, society wants you to be, I know that I would be healthier. I have experienced, you know, but at the end of the day, like creating a system where I feel, I mean, I lost 5 stone 5 years ago, in 10 months, I think. And I kept a lot of it off for quite a long time, but I was very mentally unhealthy. Like, we need to take health as a very you know, a holistic picture that looks at your mental health, your physical health. Like if for me, existing in a body, and by the way, after losing 5 stone, I still wasn't classified as normal on the BMI spectrum. I was incredibly mentally unwell. Like I wasn't eating, like I wasn't, you know, I wasn't happy. I didn't have energy. Like, I think we need to, the pressure that, you know, it ends up being emotional. The problem at its worst is that pressure makes people stressy. Like for me, you know,
I can see that it's a cycle for sure. And I'm interested in this notion of designing an empathetic, sort of holistic and consistent set of policies. What I'd quite like to do is see if we can unravel what that would be. There was a Holly S. I'm not sure what your surname is. If you're there, I'd love to hear from you, because I think you asked, in many ways, the sort of killer question on this, which is we've talked about how a wrongly framed approach that targets the symptom, not the cause, isn't going to help, and an over-exaggerated, to Rose's point, framing everything as a problem is shaming and targeting and demotivating and all of those things that it is. But your question was, what is a proportionate response?
Yes.
What do you think, Holly?
I mean, I don't have a view on exactly what a proportionate response is, but I think my question comes from kind of paying attention somewhat, I might not be an expert on body positivity, people speaking about that, people writing about that, and this piece around there's a lot of shame, and actually it's really kind of like, you're doing something wrong, it's very dangerous, you're really putting yourself at risk, you're putting the NHS at risk. And I mean, appreciate we have had some really amazing responses to smoking. It was interesting hearing Dolly talk about how effective that those pieces were. Yeah. But we don't really seem to hear anything about, yes, obesity might be something that is putting people at risk, but is it putting people proportionally at more risk than some of our other unseen behaviours? And I always think of alcohol in that, because I just think we have a very unhealthy, in my opinion, a lot of us have an unhealthy relationship with alcohol, but it's not got shame or stigma around it until potentially it goes into a very dark place, but not in the same way that we're quite happy to put a lot of emphasis or shame on what we consider to be overeating. And I never really hear it put in perspective or kind of placed in that. And I'd be so curious to find out where you get that, and if our response to that is proportionate.
Yeah, it's a really good point. I think that the comparison of the relative social positioning of excessive drinking, or just even any drinking, as a bit of a laugh, quite a British thing to do, you know, it's all a very different kind of vibe than, you know, overeating, if you like, and a good question I don't know the answer to. I've just noticed Una O'Brien make a point in the chat which Mira or Dolly may know the answer to. Una, are you there?
Yeah, I'm here.
Because you're talking here in your point to this thing, which I think speaks very closely to what Rose is talking about, which is there's a sort of a sense of body size which is to do with what you look like, and there's a sense to do with your body and what you put in it, which is to do with how healthy you are, and we rather oversimplify the connection between those two things.
Yeah, I mean, I've just been very interested to learn more about what an unhealthy diet actually does to our organs internally. I mean, I hope it doesn't sound too icky to be talking about this time of the evening, but for me, that's really been the thing that shifted my thinking once I understood that. And we don't really talk about that. We tend to talk about the, how we feel about our bodies, how our bodies look. But the real breakthrough time for me was when I actually understood what excess sugar over a period of time can do to your organs, and the damage can be irreversible. And when I really got that, I was like shocked. I thought, why don't we actually talk about this? So there's something missing for me in all of this debate about the actual clinical facts. And I'm also worried about a lack of good nutrition, as much as I'm worried about excess weight, because there's a lot of people who, especially children, who are not getting decent nutrition. And I think we should be worrying about that as well, how to support a healthy weight.
Yeah. Thanks ever so much, Una. And I think that's a good segue, maybe, if I come back to Mira, and there may be people in the room who have knowledge of this particular thing. Now, I absolutely love Dr. Chris and Dr. Zand. I have an 11-year-old and 9-year-old who were born and raised on Operation Ouch, and I've watched Dr. Chris do his BBC documentary, What Are We Feeding Our Kids? And that he really turns his guns on ultra processed food, particularly the sort of industrial scale food industry. People will have seen the Nestle leak this week that was published in the FT, an internal document circulating at Nestle in which they admit that 70% of the products they make don't meet the generally accepted definition of what is healthy. Mira, what's your perspective on this question of, I suppose it's the specific question of ultra processed food, and specifically, or perhaps more widely, in sort of industrial, large scale food manufacturing, what is the right way, which is a very powerful it's a very powerful thing. You've written recently in the BMJ where you talk about the power of the food industry. Just to help us to try to draw that out a little bit.
I mean, first, kind of going back to Una's point about kind of people understanding, I do think that a huge thing is that people don't really understand much about diet. They don't really understand kind of what a healthy diet is, kind of what certain healthy foods do for you and what unhealthy foods do for you. It's like what Rose said about how there are people she knows who aren't overweight at all, but are extremely unhealthy, and then therefore likely to develop various conditions just solely based on their diet. And I mean, that's something that a lot of policies and things don't address. All this stuff, I mean, all this stuff about food labeling and things, it is kind of giving you some information, but it's to Una's point, do people really understand what that is actually doing to you? And I think a lot of people, until you kind of develop heart disease yourself, or, you know, get told that you are pre-diabetic, or, you know, any of the number of things that can happen if you just eat badly or eat poorly, I think that's when you read up on everything and try to understand everything. And until that point, it's very much the point, I think, what Dolly and Rose both said, is that the food environment, the industry around you, like everything around you is kind of affecting the way you eat and making you think certain foods are healthy, like certain healthy foods, you know, that are badged as healthy. You actually look at the ingredients within them, and most of them aren't. There are various kind of artificial products in there, or additional flavors, or what have you, but it's very much billed as a healthy item. I see that very much with my children, actually, like the foods that you see as kind of vegetable sticks and all that kind of stuff. Like you actually look at them, there's like 1% of a vegetable powder or something in there. But just so that, I think all of this environment comes in, it tells you you're eating healthily. Certain people think they're eating healthily, but they're actually not. Are people really understanding things? Just to bring something in personally, so with my most recent pregnancy, I actually had gestational diabetes. Right. And so I'm somebody that's reported on diabetes loads over, you know, 10 years or so, and I thought I knew everything about it, but there was quite a lot I didn't know, just in terms of how certain foods really affect you, how they shoot your sugar up, and how they can cause you to develop it. And the urgent nature of having that during a pregnancy forces you to read up everything, know what all the different foods do. And it's changed my diet now, to be fair. I thought I was healthy before, and I think I was relatively, but I'm more healthy now because I understand so much more about what processed foods do, and what certain, you know, which foods have sugars, which foods have, you know, starches, and all that stuff. Things you even, you know, a health journalist, you think you know this stuff, and then you don't. So what do you expect of people that aren't reporting on this every day and reading about it every day? And that's where the power of industry comes in. They're feeding you with information, they're making you understand things quickly with advertising, marketing, and so on. And then in addition to that, you know, they've got power over our governments and over policies and things. They've got the money and the power to fight policies that might ask us to tax them, or ask them to be taxed, and pay more. And just that's the main, I mean, industry is a huge barrier in so many ways. It determines the food available to you, but then it blocks kind of things that are being put in place to try and make you healthier. And I mean, I've completely forgotten what your question was. It
was really to do with the power of the food industry. And I suppose the thing that you're saying is that there are these large organizations that we sort of know it's there, but it's discombobulating really when you think about over here is the government's, if you like, war on obesity, terrible terminology. Yeah. Over here is eat out to help out. Let's not go down. That's a whole nother thinking in itself. In fact, we did that one. And over here, there is the food industry that is incredibly powerful, that is funding some of the research into what is and isn't healthy, that is really able to lobby the government not to implement strategies that might affect outcomes. How do you begin to unravel that?
Well, so I mean, one thing is that for example, when we see studies as a journalist, you'd hope that the stories that you're seeing in the news and so on, that you do kind of, when we assess what we would report on, you look at kind of industry involvement and conflicts of interest and things like that, and really assess that when you're looking at findings that are related to this whole issue as a whole. And I think secondly, like, you need a government that's going to push back on industry. Every expert I've ever spoken to has always said that, because there's clear evidence, say for example with the sugar tax, Dolly will know more about this, but study after study have shown the impact the sugar tax has had on sugary drinks and the amount of people drinking them. In Mexico, there are loads of statistics because they were among the first to implement it. In the UK, I think it's had almost a 30% reduction in people drinking it. So the proof is there, and taxation helped towards smoking as well and reducing smoking. So we know that that can work, but yet governments will try and introduce it, and policy and industry will push back on it, and you're not seeing it being applied to fatty foods or high calorie foods or energy dense foods. But it's there, and we know that that should happen, but industry is having this power over governments to actually do something about it. And yet every expert out there is trying to kind of change this environment and the food that's being given to us and the food that's being dictated by a very powerful industry.
I'm going to go back to Dolly with a specific question. I can just see Carolyn Reynolds has just said, if we can do this with smoking, we can do this with sugar. It's a very seductive point of view, and the correlation you made with the cultural shift in attitudes to smoking is a potent one. I want to be persuaded by it. But cigarettes are a single enemy. And with food, I know some people say it's sugar, but a while ago it was salt. There's also calories, there's now ultra processed, there's high fat content. As somebody who has, I would say, an unhealthy relationship with food one way or another, I grew up in the 80s. My mum was constantly on a diet. I used to go with her to Weight Watchers. She found it stressful and upsetting. I found it stressful and upsetting. The whole thing, I'm not unique at all. I just don't know what to choose. So it's not like tobacco, because there are just so many competing theories. And I think as an individual, when you're there in your Tesco's thinking, I've got to buy something for dinner, to people's points, my kids are hungry, I've got a tenner, I need to feed everybody for 3 days. How can we begin to simplify this? If we've learned anything from the success of populist governments, it is keep it simple. How can we deploy a much, much simpler messaging for people that will stick?
I mean, you've raised a number of points, and this is a complex issue. It's why I'm absolutely fascinated with it. Otherwise, I would be terribly bored, because there is a never-ending development to this whole agenda and how to even think about it. I mean, what I would say with anything as complex an issue as this and ever changing is just accepting that. So that means the definitions, our understanding will continually change. So I feel like trying to cling on to simplistic definitions of what is healthy, unhealthy food, all of that kind of stuff is where it becomes problematic. But at some points we have to make distinctions in order to make policies around them. And good examples are where we are starting to see a shift from talking about HFSS foods, so foods high in fat, salt and sugar, moving towards the ultra processed, which you made reference. I put it in the chat, the link to Chris's article based on that. And the ultra processed food space is a very interesting and very promising area in terms of research, and a way of understanding the foods that we should be understanding what should be kind of less prevalent in terms of the availability and the bombardment through advertising, promotions or whatever, versus less or minimally or not processed food at all. And this whole area is weaponized depending on what perspective you take, because I hear a lot of arguments from certain politicians who are sort of anti-nanny state or whatever in this space, trying to make the case that when you start talking about HFSS foods or typecasting of that, then you'll automatically be talking about butter and avocados and, whatever it is that they try and group in. And obviously, we try and say in the sort of public health community, obviously we're not saying that those sorts of foods should be, reduced and banned. We're talking about the problem when it comes to very, very poor quality foods being so widely available, so widely advertised, so widely promoted, and so disproportionately promoted and advertised in comparison to healthier foods. And just to give you an example, in terms of TV advertising, some research has shown that 46% is unhealthy foods or the HFSS foods versus just 2.5% for fruit and vegetables. And so we try and talk about it if our world is not like the balanced diet that we talk about we should be consuming in terms of advertising. We don't have a balanced diet of advertising, balanced diet of what food is available, what's promoted or whatever, then of course the nation's diet is not going to be a reflection of that. If the easier, most appealing, most available, cheapest, most convenient is going to be the unhealthier options, then of course that's going to translate into people consuming it. And we can see that in the numbers in terms of ultra processed food. I think it's around 57% of the nation, of the entire UK population diet is ultra processed, which was a statistic for me that I found shocking. And then suddenly you look around and you're like, yes, I can't recognize most of the ingredients in this, you know, nature bar.
What is it made of? Exactly.
Exactly. And so I would love to see a world in which we have that balance there, and it isn't about villainizing kind of certain types of foods and kind of overemphasis on that, but just looking at it like, is the world balanced in favor of the healthier options, which currently it's not, and our consumption habits are a reflection of that, and yet we blame individuals, which is just a ludicrous nightmare cycle that we've got ourselves in.
Absolutely. Thanks, Dolly. Is Sian Woodhead able to come on? I think, Sian, you're a children's social worker up in the Northwest. Hiya.
Yeah, hi.
Nice to see you.
Thank you.
What do you make of all this?
Yeah, lots of interesting comments in the chat that I really agree with. I think from my experience, the families that I work with struggle with a lot of things. It's not just as simple as they're making unhealthy choices. They're time poor, they're money poor, they're opportunity poor. You know, it's okay if you've got time and money to go and do your nice healthy shopping, but actually if you've got 6 children that all need feeding, and it's much easier and cheaper actually to buy them at McDonald's than it is to cook them a nutritious meal that you might not know how to cook as well. That's what I find with a lot of the families, that they haven't learned from their parents or from school what nutrition is, how to cook those more healthy meals, how to make money stretch, how to have budget. You know, there's real poverty issues in the families that I work with, that means that although they would like to feed their children healthy food, and they would like to be healthy, and they would like to go to the gym, and they would like to take their children swimming, it's not possible. They don't have the skills, the time, or the money to do that.
Sian, a question I wondered you might have experience of. I do remember talking to Yelena, she's here tonight actually, a while ago. We're going to have a food summit later in the year, and we were talking about this question of food and the relationship between food and poverty and things like that. And Yelena made a point I hadn't thought of before, which is to say that the ability of people, particularly on low incomes, to access healthy food is significantly impacted by the shops that are near where you can walk to, and how many people, a surprising number of households, their grocery shop, you know, their local shop is a petrol station, because that's the one that they can walk to.
Yeah, or a chicken shop.
I mean, I live in the middle of London, so that you can walk to shops. But is that something that you have experience of yourself with the families you work with? That or it's a local corner shop that's just full of, you know, Mars bars and Monster kind of thing?
Yeah, absolutely. And you find a chicken shop or a pizza shop on every corner, but you don't find a shop that's selling fresh ingredients. And some of the families that I work with, most of the families don't have a car, and if they have, I'm a disability social worker. So you've got the extra challenge of having children that have additional needs. The parents that I work with can't get on a bus with their 3 children, 2 of whom might have additional needs, to go to a supermarket out of town or to one of the retail parks. But they can manage, you know, to walk around the corner to the chicken shop or the McDonald's, which are everywhere. There are more McDonald's in the town that I work in, and KFCs and other things, than there are accessible supermarkets, definitely.
Yeah, thanks ever so much, Sian. Nice to see you. Is Bex Cotty there? Bex, you're super active in the chat. You've talked a little bit about the nanny state. You've talked about people going to their GPs, and now what have you given up?
Processed sugar.
Oh gosh, and how long ago did you manage that?
3 years ago.
And how do you know that there's processed sugar in a thing? What's your...
Well, you can see the ingredients on things that you buy, and when you move away from buying things that are pre-made and making things yourself from scratch, then you've got far more control over that. And I appreciate that everything that's been said about people's education levels and opportunities and deprivation and budget and all those things, and you know, I'm just in a very privileged position to be able to have the education levels and having been taught and having a very supportive husband who loves to cook and on all these things. So, but yeah, I made that decision because I recognized I was addicted.
Interesting. That's really interesting.
And coming off it was like an addiction.
Was it?
Yeah.
did
Headaches,
you do it in
shakes,
or did you relapse, or did you manage to do it straight off? You just gave up and that was that?
I just gave up, went cold turkey, as they say.
Goodness. And you feel better now as a consequence?
Absolutely. You can, blood sugar, you don't have those drops in the afternoon. You can go throughout a whole day. You don't get kind of hunger pangs for things. And yes, at the beginning there are cravings and strong cravings, and that takes willpower and strategy, you know, like filling up at the pump rather than going into the shop to when you fill your car with fuel. But yeah, you just after a while, now I look at things, I look at a box of chocolates or some things people eat at work, and it makes me feel quite nauseous thinking about eating it.
Interesting. Thanks very much. Is Francesca Harris available to come on? Are you there, Francesca? Maybe she is not. Not to worry if not. Yelena, you've put your hand up. I just massively paraphrased something that you taught me when we had a call a while ago. What do you make of all this? I know you're super involved and done quite a lot of work in the relationship between food and poverty and food in general, actually, and healthy food and things. What are you making of all this?
Oh, I think you actually said it a lot more articulately than I probably did when we had that conversation. But I think this has been really interesting, and I'm so glad that Dolly and Rose have both spoken quite a lot about the need for holistic policy on this, and recognising how socioeconomic factors really tie into access for food. I think for me, the project that Liz mentioned earlier, I did a podcast last year for the Net Zero project that Tortoise were running at the time, the Moonshot, but my project was about debunking the myth of buying local with food, and how the idea of local food and food miles is often mythologized, basically. But some of the most interesting discussions I had in that I didn't include because they weren't as pertinent to the net zero message, was about how COVID has really highlighted how local and global consumers lack sustainable access to healthy, nutritious food. And I spoke to Anna Taylor, who's executive director of the Food Foundation, and she was saying how despite taxes and the fact that we have unhealthy processed foods, they have such long shelf lives and high margin potential that means they are something like 3 times cheaper than healthy alternatives. And that's why they make up as much as 60% of our calorie intake. But the challenge in that is that at the same time, food, as in healthy, nutritious food, is too cheap, or rather expensive. And you've mentioned about the sort of healthy alternatives and the fact that it's more expensive to cook a healthy meal. There's a real imbalance there, and that can partly be redressed by us rethinking our value of and how we value food economically, rather than looking at it at a price base, going back and seeing it from the nutritional value of the food. So I think it's like you have to eat something like 8 tomatoes today to get the same nutritional value as eating 1 tomato in the 50s and the 60s. And that really just highlights the fact that the economic and the nutritional, the health value of food today is so disconnected, and how that then plays out in pricing and in taxing means that it's really damaging, and it's damaging to people who are already disenfranchised by that system.
Yeah. Thanks, Yelena. I wonder if I might come back to Rose. I'm just conscious of a sort of angle on it. I'm also conscious that the gender mix in this evening's thinking, you can't help but notice that it's mainly women. I know there are some men watching too. Rose, I read a book. In fact, she did a thinking of an influencer. She's called Steffi Bower. She wrote a book last year called Fattily Ever After, which I'm sure have seen. And in it, she talks about this, she talks about lots of things, misogynoir and body shaming and body positivity and lots of things like that. It's very well worth reading. I learned a lot. And according to her definition, what I am is socially acceptably fat, in that I'm overweight, but my body shape hasn't sort of, it doesn't stop me from doing things, if you like. I don't sort of walk into a pub and feel that people are pointing at me or being mean or that sort of thing. And again, I'm paraphrasing Steph's book, so I hope I've done a reasonable job of what she means by that phrase. Now, I'm very privileged. I don't have any of the challenges of the people that Sian works with, for example. I have enough money. I live in London where I can access healthy food if I want to. But I know that I don't always make good choices in that regard. But I really don't have an excuse other than I'm a bit knackered, I fancy a pizza. That, you know, these are my patterns. Now, clearly, I've talked about, I carry guilt and sadness, and we could argue that that's a mental health thing. I don't know, but aren't I the problem? Shouldn't I be sort of somehow told by my health insurance people that I have to pay more because I'm not making good choices? I don't know if I should let myself off the hook, because I've got no excuse, really.
I'm just going to say something that was very helpful for me in terms of, like, I mean, I struggle like a lot of people, but it's not actually your fault. I think is an important thing to remember. Like, even if you've learned if you've learned an emotional coping mechanism to eat when you feel sad or eat when you feel happy, like we have as a society, we have a very distorted relationship with food that has become very emotional. Like if that is the way that you eat, it's the way that you were taught to eat, and that's not necessarily blaming your parents, that's society. Like that's the way that we're all, you know, a lot of our education comes from going to school, seeing what other people eat. You know, I've got a very naturally thin best friend who I grew up with. Like, you know, we always ate the same. I gained weight, she never did. Like, she's the same person that, you know, was back in her size 10 jeans like 4 weeks after giving birth. We have very different bodies. Like, I think one thing that I have learned is that you know, we talk about obviously healthcare outcomes, like, and when you're looking at like healthcare systems, they do everything on averages. And what we know from healthcare is, you know, if you look at personalized medicine and the way that, you know, the advances that people have been making in terms of things like cancer, or, you know, the way when we actually look at people's own genetic predispositions and the way that their bodies respond to things, actually they can be completely different from one person to the next. I think a difficulty when it comes to eating is that, you know, we don't necessarily know, you know, maybe, you know, eating more carbohydrates is not so good for certain body types. Or I think one particularly interesting thing I have learned is my mother was diagnosed as pre-diabetic a few years ago, and she reversed it through diet because she's a biochemist by trade, and she read all the books and she learned, and she did exactly what I can't remember what her name was talking about. You know, she cut out the sugar and she learned a lot about, you know, nutrition, and she has reversed it, and that's fantastic. And actually, you know, she talks a lot to us about it, and because I know obviously I'm probably predisposed to have the same sort of you know, bodily responses to different things. Either way, like, it's very difficult to take to sort of copy and paste one size fits all in terms of this nutrition stuff. I think in terms of feeling responsible, like, you know, obviously I'm not going to sit here and say like, you know, no, but you know, like we don't like eat necessarily. Most of the eating that we do is not, you know, us out eating because we need energy or whatever. A lot of it's ritualistic, it's habitual, it's you know, it's learned, it's emotional. Like there's got to be a reason why so many people like ate so much through the pandemic. I know I did. Like I was a single person at that point living on my own. Like it was the only thing I could do. And actually
the way
I
you
saw it
punctuate the day as well in the
well,
long
it's the way, and I just, like, you know, I think a lot of my work, I try and break down the stigma. I'm very big on exercise. Like, I exercise more than most people I know. Like, I did a big women's health campaign around being a plus size, very fit person. Like, you know, it's a big priority to me, and it always has been. But, you know, there's a reason why when the world was falling apart, like, a lot of us started eating. Like, I found, I actually, after like last year, as much as I struggle with weight gain, like I definitely did feel like, you know, staying mentally healthy was more important than gaining a stone. And eventually I will lose that stone again, and I will do so because I'm fortunate enough to have access to information on how best to do that. But I think it's very difficult, and one thing that I come up against a lot is that, like, many people don't really understand it. Like, they don't really understand, you know, the majority of diets are, like, not sustainable. People will lose weight and then gain it again. That's kind of because we have given too much influence to private sector companies who have something to gain from us being a bit confounded. And as you say, there's, like, always a different approach, like, whether it's, you know, there was this whole low fat thing, which, you know, everyone took as Bible for, like, decades, and now, you know, people are focusing on different things. I think it can be very confusing. I don't think you should blame yourself if you have found, growing up, you know, in a society that, you know, both encourages you to eat. It makes, you know, all of our socializing is built around eating, but at the same time vilifies you for gaining weight, like, in that situation. And you know, you go into a supermarket. I remember every single time I've tried to lose weight, you know, you are constantly having to say no. You don't just say no once, like, you say no 100,000 times a day, every day, everywhere you turn. So I think, you know, society is set up in a way, like, yes, obviously, like, at some point we all have to say, you know, I want to try and make better choices. But if the world is set up in a way that, you know,
you're swimming against the tide,
yeah, like, I think that's, you know, and I think, honestly, like, the biggest lesson I have learned is that when you so emotional, like, the ironic thing is that emotional eating is being such a huge factor. The more that I feel emotional about, like, my body and my weight, the more I eat, right? So actually trying to, like, take the blame away, not feel so bad about myself, and not blame myself, and take the pressure off, is actually a better way for me. So I think, you know, beyond just, you know, taking personal responsibility, I think you have to take blame out of that. You have to feel, you have to say to yourself, like, you know, if I've been brought up in an extremely dysfunctional society when it comes to food and eating, and I have a dysfunctional relationship with food and eating as a result, like, is that my fault? No. Would I like to change it? Yes. And then, you know, take it from
Rose. I'm just very, very conscious of time, and we've hit 7:30 already. I want to say a really, really big thank you to everybody, of course, to Dolly and to Mira and to Rose for being our invited experts, but to everybody who's contributed in the chat and on screen. I'm just I've made a ton of notes and things that will stay with me, and I think we need to ruminate on, because this is obviously a very big and sprawling topic, and for us to be useful journalistically, we need to find ways in that we can kind of hang our hats on, if you like. Ralph Graham Lee has made an excellent point in the chat. He stayed quiet all this time and then has done a mic drop towards the end, which is to say, blaming individuals is just a smokescreen for not addressing the real causes. Food industry pushing highly profitable and potentially addictive processed food, a built environment which prioritizes motorized travel, long working hours in mainly sedentary pursuits, and a lack of accessibility to reasonably priced nutritious foods. I think there's sort of, if there's an element that I've heard this evening that Ralph is missing, or rather that I would like to sort of add in or layer on top of that, is Dolly's point about it needs to be easy. Holly has just said it really brilliantly. It shouldn't take exceptional willpower to maintain a healthy diet. It shouldn't feel this hard. I think easiness goes with simplicity of messaging. I'm discombobulated. I've read too much. I know a little bit of everything, and I've ended up knowing nothing at all about how to make those good choices. And the point that Rose made, I think, very powerfully, about the connection between emotion and food. There's a reason we all turned to food when we were locked down. I think that is, she's absolutely right to say that that just feels completely missing from the current way of the government's food strategy is designed, and it seems to be sort of tinkering around the edges. I think Mira was very compelling when she talked about the power of the big food companies, and how then I think ought to be a renewed commitment for a much more consistent way of addressing how those organizations are fulfilling their requirements to be responsible companies, responsible for us as human beings and their consumers, almost as much as we have a huge amount of scrutiny now on the big hydrocarbons, oil and gas companies. It feels to me that this is almost as important an issue, and a similar level of sort of public scrutiny needs to be applied to the operations, cultural processes and sort of orthodoxies of the big food manufacturers. There's a ton of stuff in there that has been really fascinating. I'm going to try and pull it together in some kind of a shape, but I've really enjoyed it, and I want to say a big thank you to everybody for sharing honestly. And we didn't even really get into health and healthcare and the sort of the sharp end of treatments and things. Maybe we have to save that for another day. So please do go and have a healthy and nutritious dinner, or a completely unhealthy and non-nutritious dinner, whatever you fancy. And I'll hope to see you again. Our next thinking is tomorrow at lunchtime, 1 o'clock, and we'll be talking about whether Team GB should boycott the Winter Olympics in Beijing. I will hope to see you then. Thanks very much. Bye bye.